Okay, so good evening, everyone. Today we will read Thuja Occidentalis. You can see the Thuja plant in the picture. Okay, so this point first we can correlate. Like if you will see the plant of Thuja, okay, so you will find the verti-like growth. Okay, similar. So this point we can correlate with the doctrine of signature. And for the first time, doctrine of signature was given by Dr. Paracelsus. Okay, sometimes you will get question. Doctrine of signature किसने दिया? The name of the man is Paracelsus. Paracelsus ने क्या दिया? Doctrine of signature. Okay, okay. Doctrine. कई बार question आता है. Who has given doctrine of signature? So answer will be Paracelsus. Okay, okay. So just try to remember this point. Okay. But if you are seeing the picture of Thuja, so can anyone tell me which part of the Thuja is used in the preparation of medicine? Can anyone tell? The
Fresh leaves.
fresh root and leaves both. Okay. Fresh root and leaves is used in the preparation of medicine. तो क्वेश्चन क्या आता है? क्वेश्चन आता है कि which part of the plant thuja हाँ, which part of the thuja is used in the preparation of medicine? So answer will be fresh root and leaves. ये क्वेश्चन आता है, ऐसे टाइप के क्वेश्चंस आएंगे. Okay, so we have to keep in mind. Okay, and this medicine is prepared under class 2. Okay, like in first BHMS we have read in the pharmacy, there is a first to 9 classes there. So this class is prepared, this medicine is prepared under class 2. Okay, इस मेडिसिन को क्लास 2 में बनाया जाता है. Okay, so we have to keep in mind. And before starting to this medicine, first we will talk about the introduction, which is said by Dr. James Tyler Kent. Okay, the name of the book is Lectures on Homeopathic Materia Medica, and which was came in 1904, which is containing 187 medicine. So what Dr. James Tyler Kent has said, if we will talk about the appearance, the general appearance of the Thuja subject, if he has a characteristic picture, is that of a waxy, shiny face. It looks as if it had been smeared over with a grease, and often transparent. Okay, suppose if the patient is coming to you, then if you will look to the patient face, it will be always looking like a shiny, greasy appearance you will find, like so much oily face you will find. There will be a layer of waxy you will find, so much waxy. If you will put the finger over the face, you will find there is a so much oily. अगर पेशेंट आएगा तो इतना जैसे लगेगा कि ऑयल या ग्रीसी टाइप का फेस उसका दिखता है. And this is said by Dr. James Tyler King. And this and so much sweating will be there, so much oily greasy will be there, and this patient will be having the peculiar odor. Like if we will talk in the genitalia, you will find a honey-like sweat. You will be find honey जैसा smell होता है sweating का, especially in the genitalia region. But Dr. Kent has mentioned a different odor also. Like sometimes a garlic like strong pungent odor we will find from there. Okay, but why this patient? And sometimes this odor is like a burnt horn, burnt feather and burnt sponge. ऐसा लगता है कि जला हुआ पंख पंख होता है ना, जैसे चिड़ियों का, पक्षी का. ओके, फीदर. ओके, बर्न फीदर्स. ओके, या स्पॉन्ज जला हुआ, वैसा स्मेल आएगा. And why this is happening? Because if there will be a water like growth, and that will be discharging, and that discharge is a peculiar character will be there, like burnt feather, like burnt sponge like, and sometimes garlic like, and sometimes honey like we will find. Why? Because there is a growth of a warts over the genitalia, and because of that there will be a this type of a peculiar odor. But if you are talking about the peculiar odor, now we can correlate with the organ of medicine. Dr. Hanman has mentioned about the characteristic symptoms. So can anyone tell me where Dr. Hanman has mentioned about the characteristic symptoms? कहाँ पे हैनमैन ने बोला है?
153 aphorism.
Yes, very good, Hina. That is 153. Sometimes question you will find PQRS symptom is mentioned in organ of medicine where it is. So answer will be 153. Just try to remember ये organ से question आता है. ठीक है? Okay. And this was the introduction what Dr. James Tyler Kent has said. Now again I want to tell you the another introduction which is mentioned by Philip M. Bailey. Philip M. Bailey. The name of the book is Homeopathy Psychology. What he said? He said that Thuja is a sacred remedy. Man, he is a very sacred remedy. So you will find the Thuja personality is very easy to miss, partly because it is uncommon, but mainly because it is so close and secretive. Many Thuja patients, particularly the male one, give so little away during the interview, and that one is left with the impression of the mystery man. Okay, why this patient is knowing as a mystery man? Because he will be always secretive. कोई patient आता है बहुत ज्यादा secretive, he is not going to talk with everyone because he is aloof and distance nature will be there. Self-observe is there. Why? Because the Thuja is having a so much sexual desire, and he will be doing a so much sexual sex. He will be performing so much sexual excess with a so many person, and that's why this patient is developing a gonorrhea like symptom, and you will find the suppression of gonorrhea, and that will develop like a what like growth it will be developed, and sometimes the patient may be suffering from the STD, and he is performing so much sexual intercourse. So after some times he will realize and he will feel like a guilt. मैंने गलत किया, मैं ऐसा किया, मैंने ऐसे कैसे कर लिया? And that's why he is avoiding to talk with a person. That's why this patient is mentioned aversion to company. So this aversion to company we can correlate with the Kent repertory under the mind section. Company aversion is there. Okay, so under the Kent repertory under mind section you will find aversion to company. That's why this is known as Thuja is known as according to Philip M. Bailey, and this is mentioned. The name of the book is Homeopathic Psychology. He said that Thuja is a secretive person. He is self-observed, and this Thuja is known as a mystery man. Why? Because he will be hiding everything. Everything he will be hiding. And Thuja is very closely related to the Medorinum according to the film M. Bailey. Both are having the sexual intercourse and strong sexual desire is there, but he will be hiding, and मेडोरिनम विल बी एक्सपोजिंग हाँ मैंने 10 लोग के साथ सेक्स किया है मैंने इतने लोग के साथ सेक्स किया है and that's why medorinum is also having a suppression of a gonorrhea, and that's why the medorinum patient is also suffering from the gonorrhea. Why? Because thuja and medorinum is having a sexual intercourse relation. Okay, wait. So I was telling about both are very closely related with each other, like Medorinum and Thuja. Both are having a strong sexual desire. But this Thuja is a mystery man. This Thuja is hiding everything. And after sometimes he will feeling so much guilty. Why I have performed so much sexual intercourse? And if the person is performing so much sexual intercourse, so he will be developing a headache. You will find it is written in the Allen keynotes. Okay, and that's why the medorinum is the complementary of thuja. Okay, this is the relation between medorinum and thuja. Okay, so this was the introduction, what I have told. Just try to remember. Okay, and this medicine, commonly known as Arbor Whitey, Tree of Life, American Arbor Whitey, and White Cedar. So how you will remember? Just try to remember तवा. तवा घर में तवा होता है, रोटी बनता है, तवा याद रखना. ओके, रोटी बनता है, तवा याद रखना. T for Tree of Life, A for Arbor Whitey, and W for White Cedar, and A for that American Arbor Whitey. Okay, just try to remember. कई बार आता है क्वेश्चन कि थूजा का दूसरा नाम क्या है? What is the another name of थूजा? Either ऑप्शन में क्या होगा? white cedar is the common name of which medicine? In option you will find Thuja, Lycopodium, Medorinum. It can be anything, okay, in option. But if you will know the white cedar is the common name of Thuja, so you will remember, okay. So just try to remember this mnemonic tawa, okay. And this medicine is prepared under class 2. So how you will remember? T for 2, T for 2 and T for Thuja. टी से क्या होगा? थूजा होगा. टी से क्या होगा? टू होगा. Okay, so this medicine will be prepared under class 2. Just try to remember. And this medicine is proved by Dr. Christian Frederick Samuel Hahnemann. Okay. Okay. Another, let's talk about the symptoms of Thuja occidentally. Adopted to the hydrogenate constitution with gravigal, which is related to the psychosis, effect is to cause hydrogenate constitution, you can see. Okay, hydrogenate constitution. First you will get the question key types of constitution which is given by whom. So answer will be ग्रेवोगल. ये क्वेश्चन आया हुआ है, ठीक है, ये क्वेश्चन आया हुआ है, क्यू पॉइंट है, याद रखना. क्वेश्चन आया हुआ है 4 years ago. Okay, the type of constitution who has given like carbonitrogenide and oxygenide and hydrogenide, these are the constitution. Okay, तीन टाइप के constitution होते हैं. क्या क्या होता है? कार्बोनाइट्रोजेनाइड, एक होता है ऑक्सीजनाइड एंड एक होता है हाइड्रोजेनाइड. ओके, सो जस्ट ट्राई टू रिमेंबर. बट if the person is having an excess of a carbonitrogenide, especially in the blood and fluid, so the patient is having a problem from the carbonitrogenide. If the patient is having a excess of oxygenide, okay, oxygen in the blood and fluid, so the patient will be having problem. But if you will find a hydrogen excess, especially in the blood and fluid, so there will be a problem with the hydrogenide constitution. Okay, so now we can correlate. Can anyone tell me this carbonitrogenide is related with which myosm? This point I can we can correlate with the organon of medicine. So can anyone tell me? ये question आता है, carbonitrogenide is related with which myosm? So can anyone tell which myosm?
Soric.
Yes, which myosm? Sora.
Soric, sir, Soric.
Very good, Sora. Okay, Sora. And oxygenide? Oxygenide is the syphilis. Okay. And this hydrogenide is psychosis. Okay. So ये क्वेश्चन आता है, जस्ट ट्राई टू रिमेम्बर कि कार्बोनाइट्रोजेनाइड सोरामाइजम से रिलेट है, ऑक्सीजनाइड सिफिलिस से, एंड hydrogenide is related with the psychosis. But can anyone give me the examples of carbonitrogenide constitution? क्या क्या मेडिसिन है अंडर कार्बोनाइट्रोजेनाइड कॉन्स्टिट्यूशन के अंदर?
Sir, lycopodium.
Yes, and very good, Amit. And okay, just try to remember the mnemonic. C is Mahalujar. Okay, C is Mahalujar. Okay, C is Mahalujar. Okay, ऐसे याद रख लेना. C is Mahalujar. Okay, इस ई को याद नहीं रखना है. ओके, सी इज महालूजर. ओके, जस्ट ट्राई टू रिमेम्बर. ओके, सी फॉर कार्बोनाइट्रोजेनाइड हो गया. ओके, एंड ये इसका मतलब कुछ नहीं है. एम फॉर मर्क्यूरियस. ओके, एच फॉर हेपसल एंड ए फॉर एलुमिना, एल फॉर लाइकोपोडियम. ओके, लाइको. ओके, लाइको, and U for Artica urens, and S for sulfur. Okay, and R for rustox. This is the medicine will come under the carbonitrogenide question, carbonitrogenide constitution. Okay, कई बार क्वेश्चन आता है related with the carbonitrogenide constitution. Okay, so we have to remember this medicine Mahalujar. C is Mahalujar. C for carbonitrogenide and is means nothing. Okay, M for mercurius, H for hepasol, Hepos and A for alumina, L for lycopodium, U for Urtica urens, S for sulfur and E for nothing. इसका मतलब कुछ नहीं है. R for rustox. Okay, just try to remember. Okay, and under oxygenate constitution, what are the medicine? Can anyone tell? Can anyone tell? Just try to remember.
phosphorus,
Yes, phosphorus and
phosphorus,
yes and okay. Just try to
lachesis,
remember. Not like this. Okay. Just try to remember. There are six medicine mainly. Okay. So mainly you have to remember the ferrum phos. Okay. Ferrum phos is there. Aconite is there. Wait. Okay. Ferrum phos is there. Aconite is there. Aconite is there. Okay. Aconite and C for China. Okay. China is there and graphitis is there and A for arsenic is there and P for petroleum is there. Okay. So how you will remember? O fake. O fake and gap. Okay. O fake and gap. Okay. This is the mnemonic. Just try to remember. Okay. O fake and gap. And this is related with the oxygenate constitution. So these are the medicine under constitution, oxygenate constitution. Okay. Now we'll talk about the hydrogenate constitution. Okay. So hydrogenate constitution के अंदर क्या क्या medicine है? Can anyone tell?
So natrum sulf. Natrum
Yes.
sulf.
Very good.
Thuja है, natrum sulf में, Thuja
Yeah.
natrum sulf,
Very good, Akhil. Very good. And
So dalkamara.
yes, very good. Dalkamara is also there. Very good. And
Sir arena diadema.
yes, Arenia diadema. Very good. And there are so many medicine like Thuja is there, Calcarea carb is there, Silesia, Natrum sulf, Arenia diadema, Apis mellifica, Pulsatilla, Entimta, Dalkamara. Okay. So we can remember. Okay. कैसे याद रखेंगे? पैंट सैक. ओके. ये पैंट पहना है तो पैंट याद रख लेना. ओके. पैंट सैक. ओके. पैंट सैक. ओके. So P for pulsatilla and A for antiptart and A for arenia diadema, A for apis mellifica and T for thuja. Okay. And S for silesia is there and A for I have already told and C for calcarea carb is there. Okay. And just try to remember these are the mnemonics. Sometimes यहाँ से क्वेश्चन आता है हाइड्रोजनाइड कॉन्स्टिट्यूशन के अंदर क्या मेडिसिन है. Means there will be option. Means all the medicine is related with the hydrogenate constitution. ऑप्शन में क्या देगा? एक एल्यूमिना दे देगा. ओके. तो एल्यूमिना याद रखना है किस कॉन्स्टिट्यूशन का है. सो that will be related with the carbon nitrogenate constitution. Okay, just try to remember. So just try to remember. Okay, if the patient is coming to you and that patient is suffering from the suppressed gonorrhea and this patient is having aggravation from the hydrogenate constitution, then only we can think about this medicine. And if we will look the appearance of the patient, you will find look like a fatty flabby. Okay, लाइक गणेश भगवान जैसे होते हैं वैसे ही दिखेंगे. देखो ऐसे बड़ा सा पेट दिखेगा, मोटा होगा. एंड दिस पेशेंट विल बी हैविंग अ फिक्स आइडियाज एंड यू विल फाइंड ओवर द फेस shiny glaze appearance will be there and over miss waxy smear you will find over the face. क्या होगा? layer of waxy you can find over the face. Okay, so this point we can correlate with another medicine. So can anyone tell me there are different medicine where there is mentioned shiny glazed waxy appearance over the face? क्या क्या medicine है? कोई बताएगा?
Natrum mute.
Yes, very good, Aryan. Excellent. And Sanicula is also there. Okay, Sanicula, tuberculinum. Okay, these are the medicine which is related with the shiny and waxy appearance over the face, and acetic acid is also there. Okay, and arsenic is also there. Okay, but arsenic is also known as acute thuja. Acute, similar symptom you are finding, and if the acute patient is there, then we can think about the arsenic. But if there is a chronic, So we can think about the thuja because arsenic का complementary क्या होता है? thuja होता है. Okay, this was the correlation. Okay. Other symptoms, ailments from bad effects of a vaccination from suppressed or maltreated gonorrhea. Suppose if the patient is coming to you and that patient is suffering from any kind of problem and that patient was suffering from the suppressed gonorrhea, means that patient was suffering from the gonorrhea and he has taken some allopathic medicine. And after taking the allopathic medicine, that gonorrhea has been suppressed. And after that, he develops some complaint, then we can think about this Thuja. But if you are talking about the allopathic medicine, okay, this point we can correlate with the organon of medicine. So where we can correlate with the organon of medicine? Can anyone tell where Dr. Hanman has told about allopathic medicine? Means artificial chronic disease. It is related with the artificial chronic disease where Dr. Hanman has told in aphorism number 74 and 75, most deplorable and most incurable case. Okay, which is very difficult to treat. You will get question, which disease is very difficult to treat? Like most deplorable, most incurable. ये word mention रहेगा. Then answer will be artificial chronic disease. Okay, artificial chronic disease. Okay, आर्टिफिशियल क्रोनिक डिजीज ओके. तो ये याद रखना है, ऑर्गेनल से क्वेश्चन आता है which disease is very difficult to cure. So answer will be artificial chronic disease, which is mentioned in aphorism number 74 and 75. Okay, just try to remember. Okay, another point is there is mentioned bad effect of vaccination. Suppose like many a person, they have already taken a corona vaccine and after that they have developed some the adverse reaction after the vaccination. Okay, like I am the example. Like when I have already taken that corona vaccine, and after taking the corona vaccine, I developed there is a swelling of the lymph node, especially in my left axillary lymph node has been swelled up. Okay, but I was like I called on given a toll-free number. Okay, then they were suggesting, Miss Allopathic physician were suggesting take some antibacterial medicine, and they have suggested paracetamol. Generally, I don't like to use the allopathic medicine, but when they suggested, I took few dose of paracetamol, but I didn't get cure. Paracetamol मैंने लिया 2-3 दिन, but कोई result नहीं दिखा. But what I have taken after that, I have taken Thuja 1 m 3 dose, and that subside, and I got cured. There is no swelling still. Okay, so suppose if the patient is coming to you and that the patient is suffering from any kind of problem after taking the vaccine, and there will be adverse reaction after the vaccine, so we can think about Thuja. Okay, but there are so many medicine which is related with this. Can anyone tell क्या क्या medicine है? Vaccine लेने.
Silesia,
Yes, very good, Aryan. Silesia,
Antimtard,
Antimtard, yes, and
Meserium,
Meserium, very good, and Apis is also there. Crotalus horridus is also there. Valeriana is also there. Not Valeriana, Vaccinum. Okay, Vaccinum is also there. Variolinum is also there. Okay, and Malandrinum is also there. Malandrinum is the medicine. These are the medicine we can think where we will find the bad effects of vaccination is there. Okay, so these are the medicine for the bad effects of vaccination. Okay, fixed ideas, as if a strange person were at his side, as his soul and body were separated, as if a living animal were in the abdomen of a being under influence of a superior power. You can see if the patient is coming to you and that patient is thinking that someone is standing beside me and someone is sleeping beside me, and he's thinking that some superior power is there. Okay, and he's feeling that my body parts is separated from the body. Okay, like hand is here and the legs is there. then we can think about this medicine. And this Thuja is becoming a fixed ideas. Why? Because I have already explained this is a mystery man. This is known as a mystery man according to Philip and Bailey, and this is written in the homeopathic psychology. Okay, so this is known as a mystery man, and this is also known as guilty feeling, and this is also known as self-observed. Okay, self-observed, this is known as, okay. Why? Because this patient has performed so much sexual intercourse with so many people, and that's why he is suffering from the gonorrhea. Okay, okay. And if you're finding this symptom, then we can think about this medicine. Okay, just try to remember. But these symptoms we can correlate with another medicine. Suppose if you're finding this symptom, there are two more medicine. Can anyone tell? Sensation as if someone is lying alongside of him. उसके बगल में कोई और सोता है, कोई बताएगा क्या मेडिसिन है? Petroleum? Petroleum. Okay, not petroleum. That is petroleum and baptisia. Okay, very good. Yes. Another symptom, headache as if nail had been driven into parietal bone, as if the convex button were pressed on the part, aggravation from sexual excess, overheating from tea, chronic or psychotic or syphilitic origin. What I've already said, this person is suffering from headache. Why? Because he has already done so much sexual excess. If the person is performing so much sexual intercourse, so there will be a loss of a vital fluid, and that will causing pain, especially headache. Then we can think about this medicine. But can anyone tell me another medicine for this symptom? Headache from sexual excess. और क्या medicine है? China is the medicine. Okay, you will find China is the medicine. Okay, and if the person is having a tea, and after tea he is suffering from the headache, again we can think about this medicine. And the patient is having a headache, chronic or psychotic or syphilitic origin will be there. Means if the person is suffering from the gonorrhea, and after taking a few allopathic medicine he will develop headache, then we can think about this medicine. But if you're talking about the psychosis and syphilis, this point again we can correlate with the organ of medicine. Okay, so can anyone tell me where we can correlate? Can anyone tell aphorism number? Aphorism number 79 and 80. 79 and 80 इसके बारे में लिखा है, लेकिन प्राइमरी manifestation or primary symptoms of psoriasis, syphilis, psychosis, which is mentioned in the aphorism number 80. So you will get question. Okay, what type of question you will get? यहाँ से question आता है, primary symptoms of psora. Can anyone tell क्या होता है? कोई बताएगा? Few vesicle eruption will be there, and voluptuous tickling, itching will be there. What is the meaning of voluptuous? Can anyone tell? Psora का primary symptom होता है few vesicle.
The itching which leads to sexual desire.
Yes, means when the patient is scratching his, oh, I am feeling so much better. While it's, oh, now I'm feeling, means he is feeling sexual intercourse like he is performing. That type of feeling if the patient is getting while scratching, while itching is there, that is the primary symptoms of psora, primary manifestation of psora. Okay, so this was about psora. Now we'll talk about the syphilis. Syphilis के बारे में क्या होगा? Primary symptom of syphilis, venereal chancre is there. Okay, venereal chancre is there. Yes, venereal chancre is there. Okay, so this is the primary manifestation. You will get question from organ related with the organ. The primary manifestation of syphilis is, that is venereal chancre, but primary manifestation of psychosis is क्या होता है? Primary manifestation of psychosis,
condylomata.
Yes, very good.
Cauliflower like
growth. Very good, Aryan. Very good, excellent. Okay, that is a cauliflower like growth you will find. Okay, cauliflower like growth. Yeah, this is the primary manifestation of psychosis. Okay, So you will get question from here, okay, related with the organ. But I want to again tell you, can anyone tell me which was the first मैजम discovered by Henman? First मैजम किसने मतलब कौन सा है? Which is discovered by Henman?
Sir, syphilis.
Psychosis.
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 Very good. Psychosis is the first मैजम which is discovered by Henman. ये question आता है, and this you will find it is written homeopathy and afterlife by H.A. Roberts. Okay, वहां पे मिलेगा तुमको, ये लिखा है psychosis is the first मैजम which is discovered by the Henman. And the second मैजम क्या है? ये question भी आया है 6 years before this was the question has been asked. Okay, second मैजम
Syphilis.
syphilis, and third मैजम is sora. Okay, just try to remember. Very good.
सर
Yes,
सर ये आप क्रॉनिक डिसीज के अकॉर्डिंग बता रहे हो या फिर एच रॉबर्ट के अकॉर्डिंग?
H.A. Robert. Okay,
क्योंकि दोनों में अलग अलग है ना सर?
हाँ है H.A. Robert के अकॉर्डिंग बता रहा हूँ. Okay, and another symptoms eyes ophthalmia neonatrum, psychotic or syphilitic, large granulation like warts or blister, amelioration by warmth and covering, if uncovered part, and feels as if cold streams of air were blowing out through them. Suppose if the baby is coming, you can see the eyes of a baby. You will find this type of a discharge. You will find discharge from the eyes, and that will causing the sticking of the eyes. Okay, so there will be a closing eyes, means there will be an infection. Conjunctivitis is there. We can correlate with the disease condition. Okay, like conjunctivitis, acute conjunctivitis, the patient is having ophthalmia neonatrum, and this ophthalmia neonatrum we can correlate with the argentum nitricum, where you will find the ophthalmia neonatrum is there scarlet red with like you will find, and there will be also stickiness you will find. Okay, but you will find red wiffy color you will find. Okay, that is the particular symptoms or characteristic symptoms of the argentum nitricum. Okay, but here the patient is getting relief by warmth, and the patient is feeling something air, cold air is blowing through the eyes. But these symptoms we can correlate with another medicine. Sensation as if the cold or eyes were filled of a smoke. Can anyone tell me the name of medicine? ऐसा लगता है स्मोक भरा है आंख में, कौन सा मेडिसिन है?
सर ranunculus bulbosus?
Not ranunculus bulbosus, that is crocus sativa. But if you are saying ranunculus bulbosus, I want to tell you what is mentioned there. Ranunculus bulbosus is known as buttercup, commonly known as buttercup, that is belonging to the ranunculaceae family. The symptom is mentioned day blindness, mist before the eyes. This is the symptom which is mentioned in the ranunculus bulbosus. Don't get confused. Another symptoms, ears, chronic otitis and discharge purulent like putrid meat, granulation, condylomata and polypi, pale red cellular and bleeding easily. Okay, link over होने वाला होगा. Okay, after some time the link will be over. You have to join same link without any delay. Okay, suppose if the patient is coming to you and that patient is suffering from the CSOM. Okay, chronic suppurative otitis media and ASOM. Okay, CSOM and OSM. Okay, you will find a putrid meat-like and granulation-like growth you will be finding, and there will be a bleeding. Okay, so you can see this is the normal tympanic membrane is there, and here rupture is there. Okay, here rupture is there, tympanic membrane. So there will be a discharge. क्या होता है? The patient will be coming to you, and that patient will, डॉक्टर बाबू कौन थे के पुष्प बेरो है, कान थे के पुष्प बेरो, ऐसा लगता है कान से मवाज आता है, पस आता है. Then we can think about the patient might be having a CSOM or ASOM. This point again I want to correlate with a ENT. Okay, ENT. So how we will differentiate these cases? कैसे हम लोग डिफरेंस करेंगे? This is the case of CSOM or ASOM. कोई बताएगा?
Sir, rupture of tympanic membrane causes CSOM.
Ruptured you will find in both condition Aryan. Okay, but suppose हम लोग क्या करते हैं, स्वैब लेते हैं ना, like earbuds अगर हम लोग लगाते हैं फिर बाहर जब लगाते हैं उसमें स्टिक रहता है, मतलब स्टिक क्या होता है, जो पस होता है स्टिक होता है, बट यू विल फाइंड देयर विल बी येलो कलर you will be find which is very sticky and that will be very offensive. If you are finding this character, then so I was talking about the CSOM and ASOM. CSOM. Okay. So I was telling about the difference between CSOM. You will be getting question. Okay. Related with the CSOM and ASOM. Okay. In CSOM, you will find a yellow discharge which is very offensive and that will be sticky. That is the characteristic of a CSOM. By this way, you will come to know this is the patient is having a CSOM. But in case of acute suppurative otitis media, you will find a transparent fluid like discharge you will be finding. Okay, so you can think that this patient is having a ASOM. This is the basic difference. Okay, but suppose if the patient is suffering from deafness, so we will perform, there will be a two test is there. Okay, there are two tests. Okay, what are the name of test, क्या नाम है उस टेस्ट का, can anyone tell?
Sir, Rani and Weber.
Yes, very
Rani
good.
and Weber.
Rene and Weber test is there. Okay, we will perform especially in case of a deafness. Okay, so just try to remember, and this was the question which is has been asked in the AIPGET, I think of 15 days before. The question has been asked related with the Rene and Weber test. Okay, okay. So if you're talking about these symptoms, okay, so this point we can correlate with the Kent repertory. Under which chapter of Kent repertory we will find these symptoms? कहाँ पे मिलेगा?
Sir, ear.
Yes, direct chapter is there here. Okay, so for the first time the Kent repertory was published in which year? कोई बताएगा first time Kent repertory कब आया?
Sir, 1897.
Yes, very good. Second edition.
Sir, 1900.
Yes, 1908. Third edition 24 and fourth edition 35 and 45, फिर उसके बाद 57 and 61 and 74. Okay, but this यहां से क्वेश्चन आता है दिस 57 शिकागो एडिशन. ओके, ये आता है शिकागो एडिशन. रिपोर्टरी में क्वेश्चन आएगा शिकागो एडिशन इज नोन एज, और अमेरिकन एडिशन दैट इज द 57. इंडियन एडिशन दिस इज 61. ओके, यहां से क्वेश्चन आता है इंडियन एडिशन कौन सा है, तो 61. ओके, एंड द 74 वन इज द final and general repertory which is given by P. Diwan Harishchand. Okay, okay, so just try to remember, and this Kent repertory is having a 37 chapter, so under ear chapter you will find this type of a discharge. Okay, okay, and you will find there will be a bleeding will be there will be a bleeding when there will be a rupture of tympanic membrane. Then we can think about this medicine. Okay, and these symptoms we can also correlate with the sorinum. In sorinum there is also mentioned otitis is there, there will be a meat like discharge will be there. Okay, but sorinum is a chilly patient and there will be a desire for the sweets. By this way we can differentiate this medicine. Okay, so just try to remember. Tooth decay at the root and crowns remain sound. In the bracket there are medicine. Can anyone tell which medicine is mentioned? Meserium is there. Okay, if the patient is coming to you and that patient is having a decay especially at the root region, you can see there is a decay especially at the root region. Okay, so we can think about this Thuja and we can think about Meserium is there. But at the age, if there will be a caries or decay, then we can think about the Staphylococcus. Okay, and this there will be a crumbles and turns yellow color you will find over the teeth. Okay, yellow. Okay, but if there will be a brownish black color, then we can think about Staphylococcus is there. Okay, another symptom is there. bluish color of ranula is there. You can see ranula means cystic swelling under the tongue. Okay, you will find. And if you find why there will be a bluish color, because of varicose vein is there, especially on the tongue or in mouth. If you're finding this symptom, then we can think about this medicine. But these symptoms we can correlate with another medicine, that is ranula with fetid breath. Can anyone tell me the name of medicine? कौन सा
Sir,
medicine?
ambragrisia.
Yes, very good, Amit. That is ambragrisia. Okay, but this point I want to correlate with another medicine. Suppose if the patient is coming to you and that patient is having a polyp-like growth over the tongue and cancer of tongue is there. So which medicine we can think? Apium graveolens is there. Okay, which is mentioned in the Boric Materia Medica. Just try to remember. Okay. Toothache from tea drinking. You can see the patient is having a toothache while drinking tea. Okay. चाय पिया, चाय पीने के बाद दांतों में दर्द, हाँ मम्मी दांत में दर्द हो रहा, मम्मी दांत में दर्द हो रहा. After drinking a tea, then we can think about this medicine, and these symptoms we can compare with another medicine. If the child is uncivilized manner, he will reply in the petulantly manner, but if their patient is having a toothache, as if anything warm taken into the mouth, then only we can think about the chamomilla is the medicine. Okay, but if there is a toothache while nursing the child, which medicine? Toothache while nursing the child, which medicine?
Syncona.
Yes, very good, Ina. That is Syncona is the medicine. Very good. But if there will be a dyspepsia from tea drinking, which medicine?
Sir, pulsatilla.
Pulsatilla, yes, and Abyss nigra is there. Okay, so these are the medicine we can think. Okay, another symptoms: abdomen as if animal were crying, motion as if something alive, protrudes here and there, like a arm of a fetus. Okay, suppose if the patient is coming to you and the patient is saying like that. Okay, at this point we can correlate with the gynae and ops, and this is known as pseudocyosis. Okay, इस कंडीशन को बोलते हैं pseudocyosis. Okay, ऐसा अगर फीलिंग होता है फीमेल में. Okay, ये क्वेश्चन आया है, what is the meaning of pseudocyosis, and this was the question has been asked 6 years ago. Okay, 6 साल पहले ये आया था pseudocyosis. So suppose if the female patient is coming to you, then we can think about this medicine, and these symptoms we can compare with another medicine like crocus sativa is there, and sulfur is also there. You will find something is there inside the abdomen. But if these symptoms we can correlate with the another medicine. Suppose if there is a something is crawling under the skin, creeping under the skin or over the skin, then only we can think about the another medicine. Can anyone tell which medicine? कौन सा मेडिसिन में है? लगता है यार स्किन के अंदर कुछ चल रहा है. क्वेश्चन आता है. The medicine is cocaine. Cocaine is the medicine where you will find. Okay, cocaine is the medicine where you will find sensation as if something creeping under the skin, and that is known as formication. Okay, इसको हम लोग बोलते हैं formication. And formication you will find in the Kent repertory. Kent repertory में कहाँ मिलेगा? Under skin chapter and
Generalities.
again generalities. ये दोनों में मिलता है. Okay, so just try to remember. Okay. But here the patient is drinking tea. This symptom I want to correlate with the medicine. Okay. Suppose if the patient is having a warm drinks produces a diarrhea. कुछ भी गर्म खा लिया, चाय, coffee, anything. The patient develop a diarrhea, watery stool. Then which medicine we can think? कौन सा medicine सोचेंगे?
Fluoric acid.
Yes, very good, Ina. That is fluoric acid. Excellent. That is fluoric acid. Excellent. Piles with swelling, pain most severe when sitting. You can see there is a swelling of the piles. Okay, swelling of the piles is there, okay. And when the patient is sitting, then we can think about this medicine. And I have verified the symptoms to prescribe this medicine Thuja. Suppose if the patient, like I have already treated with this medicine, suppose if the patient is coming to you and that patient is saying, डॉक्टर साहब ऐसा लगता है कुछ फूला फूला है नस के अराउंड and that is causing so much pain while I am sitting. Okay, जैसे बैठ साहब बहुत दर्द होता है. Then I prescribed Thuja 1 m higher potency and that patient got cured. Okay, and again he developed after 3 years. Okay, why he developed? Because of like he's taking so much like oily food and spicy food. Again I prescribed the same medicine because the same symptom was there, and again he feels much better. Okay, so 3 or 4 patient I have verified these symptoms. Okay, just try to remember. Okay, okay, but I want to correlate with these symptoms. Okay, suppose if the patient is suffering from the piles or hemorrhoid, but this point I want to correlate with the anatomy. So can anyone tell me the name of a source of artery? कहाँ से ब्लीडिंग होता है, उस आर्टरी का नाम क्या है? कैन एनीवन टेल? ब्लीडिंग कहाँ से होता है? हेमोराइडल आर्टरी. हेमोराइडल आर्टरी इज देयर. ओके, कई बार एनाटॉमी से क्वेश्चन आ जाएगा. ओके, इफ देयर इज अ ब्लीडिंग फ्रॉम द anus or in case of a hemorrhoid, so what is the name of artery? So that is a hemorrhoidal plexus or hemorrhoidal artery. Okay, just try to remember. Okay, like here the patient is having a diarrhea especially in the morning, expelled forcefully with much flutters and gurgling as water from a bunghole. ऐसा लगता है छर आ गया. When the patient is passing the stool, char, एक ही बार में निकल गया. Okay, if you are finding this type of a symptom, then only we can think about this medicine. And when this will be having after taking breakfast and after taking coffee, food, vaccination and onion. You can see in the picture, onion is there, vaccine is there, and fat food is there, and coffee is there, and after taking breakfast and water like discharge if you're finding, then we can think about this medicine Thuja. Okay, Thuja we can think, but here mention diarrhea after breakfast. But can anyone tell me the name of medicine? The patient is feeling much better after taking breakfast. breakfast लेने के बाद उसको बहुत अच्छा लगता है. कौन सा medicine? Alumina is the medicine. Okay, alumina is the medicine. Okay, just try to remember. But here coffee is written. So can anyone tell me the name of medicine where there is mentioned irresistible desire for a coffee? Can anyone tell which medicine?
Angostura.
Angostura, very good, Hina. But if the patient is having a aversion to coffee, which medicine?
Sulfuric acid.
Which medicine? Aversion to coffee.
Sulfuric acid.
Yes, very good. Sulfuric acid is there. Okay.
Fluoric acid.
Sulfuric acid is there. Okay, you will find there is a patient where there will be a problem from the smell of a coffee. There is one my junior and she is always aversion. She is having a दादा आमी खाबो ना कॉफी खाबो ना हमको पसंद नहीं है. The medicine is sulfuric acid. But in case of a fluoric acid, you will find there will be a warm drinks or like coffee. It will be always producing diarrhea. Okay, so we can think. But these symptoms we can correlate with the another medicine. Diarrhea after every cup of a coffee or tea. Which medicine?
Cyclamen.
Yes, very good, Hina. That is cyclamen. Okay, cyclamen is the medicine. Okay, just try to remember. Okay, but if there is a desire for black coffee, which medicine? Muscus is the medicine. Okay, ये question आता है desire for the black coffee, the medicine is muscus. Just try to remember. Another symptom is their quiescence prevented by extreme sensitiveness of the vagina. Okay, suppose if the patient is coming to you and that patient is having a so much sensitiveness, means painful intercourse is there, and if he is putting anything like pad or anything, that patient is causing so much sensitiveness, and we can think about this medicine. And there is also medicine like platina is there. But if there is a dryness of vagina is there and because of sensitiveness is there, then only we can think about lycopodium, lysine and natrum mure is the medicine. Okay, just try to remember. Okay, because of dryness of vagina is there, then we can correlate and then we can think about the medicine lycopodium, lysine and natrum mure. Okay, but if there is a dryness of vagina is there, so what we will say this condition? Can anyone tell? Can anyone tell? What we will say? Dyspareunia is the condition. Okay, we can correlate with the gynae and obs. Dyspareunia means painful sexual intercourse. Okay, if the patient is having painful sexual intercourse, then we can say the patient is having dyspareunia. Okay, another symptom, skin looks dirty brown or brownish white spot here and there, warts, large CD pedunculated and eruption only on covered parts and burn after sketching. Okay, you can see in the picture if the patient is having warts, a flat wart if you're finding, and sometimes white spot is there or large pedunculated, then only we can think. And if the patient is having a so much wart, especially in the genitalia region, and because of that the patient is having a sweat which is honey like and garlic like and burnt horn like and burnt sponge like, you will find sweat. Why? Because there is a words, a develop of a words. That's why there is a particular like a sweating. Okay, but if you're talking about the garlic like sweat, so can anyone tell me garlic like sweat which medicine? Garlic like sweat और कौन सी medicine है?
Bovista.
Bovista is having the onion like. Okay, okay, onion like. Garlic like sweat, Artemisia vulgaris is there. Okay, Artemisia और ये वाला चेक कर लेना एक बार बोइस्टा वाला. Okay, Artemisia vulgaris is there. Okay, garlic like sweat. Okay, Artemisia vulgaris. Okay, just try to check it. Okay, and onion like breathe is there. Which medicine? मुंह से बदबू आएगा प्याज की तरह. Which medicine?
Synapse.
Synapis nigra is the medicine. Very good, excellent. Anus fissure painful to touch, surrounded with a flat warts or moist mucus condylomata is there. Suppose if the patient is coming to you and that patient is having so much pain, then only we can think about this medicine. But there should be a flat wart should be there. But this point we can correlate with the, if the patient is having an anal fissure and the pain character is there, splinter like pain is there, then only we can think about the medicine that is nitric acid is there. Okay, but we can also think if there is a sensation as if a broken glass is there, then we can think about retania.
Retania.
Retania is the medicine is there. Okay, very good, Amit. Another symptom, sensation of after urinating as of a urine trickling in urethra, severe cutting at close of a urination. You can see in the picture if the patient is while trying to pass the urine, at that time cutting type of pain is there, then we can think about this medicine. And these symptoms you will find we can correlate with a disease condition like urinary incontinence is there. In this condition, you will find this type of a symptom. But these symptoms we can correlate with the another medicine. Severe pain at the time of a conclusion of a urine. The medicine is sarsaparilla, which is also known as wild licorice and belonging to the licorice. Okay, belonging to the Leguminosae family. Okay, just try to Loganiaceae family. Okay, Leguminosae or Loganiaceae is there. Check it. Okay. Okay, chill beginning in the thigh. Suppose if the patient is coming to you and that patient is saying chill beginning, especially there is a cold feeling, especially in the thigh, then we can think about this medicine. And if there is a sweat, especially on uncovered part, you can see over the forehead, sweat over the forehead, uncovered part, or all over except the head when he sleeps or stops when he wakes, and profuse sour smelling fitted at night. If there will be a sweating and which is very offensive, then we can think about this medicine. But if there is a sweating, especially profuse sweat during waking hours, the medicine is Sambucus nigra. Okay, but sweat as soon as he closed the eyes. Which medicine? The medicine is conium maculatum and cinchona is there. Okay. But these symptoms I want to correlate. If the perspiration has the order of a sulfur, which medicine? The medicine is phosphorus. Okay, just try to remember. The perspiration has the order of sulfur. The medicine is phosphorus. कई बार क्वेश्चन आता है. Okay. Perspiration is smelling like a honey on the genitals. I have already described why the patient is having a honey like. Okay. So we can think about this medicine, and when walking, limbs feels as of a made up of a wood. When the patient is walking, the patient is feeling is made up of a wood, then we can think about this thuja. Okay. And sometimes it is feeling like a sensation as if limbs were made up of a glass and would break easily. You can see like this, if the patient is thinking it will be breaking so easily, then we can think about this medicine. Okay. Nails deformed and brittle. Suppose if the grow proper, there is no growth of a nail, not growing up properly. Okay, then we can think about this medicine. But if there is a disposition to pyronychia is there, which medicine we can think? This is the normal
So
nail and this is the dry tail. Which medicine?
diaspora.
Yes, very
Diaspora.
good, very good. Amit, diascoria. In the bracket there is one more medicine. क्या medicine है? Hepasulf is there. Okay, Hepasulf. And this medicine is especially acts on blood, GI tract, kidney and brain. इसका जो mainly action है blood पे है, GI tract and kidney and brain पे है. Okay. Its relation to the production of a pathological vegetation condylomata. What excrescences spongy tumors is very important. Suppose if you are finding this type of growth, and then we can think about this medicine, and these symptoms we can correlate with another medicine like lepis alba is there. If the patient is coming to you, there is a so much growth and spongy like growth is there, lipoma, neurofibroma is there, then we can think about lepis alba is there. Okay. But suppose this is a lipoma. Okay. And if there is a dermoid cyst, so how we will differentiate? Can anyone tell? In dermoid cyst you
Sir,
will find
puncta.
yes, very
Puncta.
good, very good, Aryan, excellent. You will find puncta will be there. अगर puncta यहाँ होगा, छोटा सा छेद होगा तो dermoid cyst होगा. Okay, very good. Excess of a venosity. I have already told about the ranula, which is bluish in color. Why? Because of varicose vein. Suppose if you're finding, then we can think about this medicine. And if any complaint is developed after the moonlight, then we can think about thuja. But these symptoms I want to correlate with the another medicine. Suppose if the patient is having a goiter and this patient is taking the medicine, especially if there is a full moon or if the moon is waning, which is said by Lippe, which medicine we can think? Can anyone tell? Name the medicine. कौन सा medicine में लिखा है?
Sulfur. Sulfur.
Not sulfur. Iodine is the medicine. Okay. Okay. Iodine is the medicine which is written in LN, which is said by Lippe. Okay. And this is the left-sided medicine and chili medicine. Okay. Suppose if the patient is coming to you and left-sided complaint is there, and these symptoms we can correlate with another medicine. Left-sided principally affected. Which medicine? Where it is written? Lilium teak. Okay. Lachesis and Thuja is also written. Okay. Variola averts the pustules and prevent the suppurative fever. Suppose if the patient is coming to you, sometimes it will avert the pustule and sometimes it will be preventing the suppurative fever. And if there is a sepsis condition, then we can think about another medicine, pyrogen. Okay. Has a specific antibacterial action. As in gonorrhea and vaccination, I have already told, like suppose if the patient is coming to you and that patient is suffering from the CSOM and either gonorrhea or bad effects of vaccination is there, then we can think about this medicine. And this medicine we can also think if there is a dyspepsia after tea drinking and chronic diarrhea after breakfast, I have already described, then we can think about this medicine. Okay, but here tea is mentioned. Okay, so there was a question which is related with the tea. Okay, bad effects of chamomile tea, this was the question has been asked in AIPGET. Can anyone tell which medicine?
Sir, pulsatilla and valeriana.
Pulsatilla, valeriana, chamomilla, not chamomilla, China is there. Okay, okay, China is also there. Very good. Asthma in children. Suppose if the patient is coming to you and that patient is suffering from the asthma, you can see in the picture, then we can think about this medicine and these symptoms we can correlate with the natrum self. If the patient is having a psychotic pneumonia, asthma is there. If the patient is coughing, but he is putting both hands over the chest while expectorating, then we can think about natrum self. And natrum self, we can think if there is a humid asthma is there, okay, then we can think. And if there is a brown spots over the hands and arms, then we can think about Thuja occidentalis is the medicine. But if there is a insomnia, means sleeplessness is there, then we can think about this Thuja. But we can also think another medicine, carcinosin is also there. Okay, but can anyone tell me specific medicine for the insomnia? Can anyone tell? Passiflora.
Passiflora.
Passiflora is the medicine. Okay, if the patient is having a morphine and after the morphine the patient is having a insomnia, then we can think about this medicine, Passiflora incarnata. Okay. Now we will talk about the relationship. Okay, relationship. Complementary. Why medorinum is complementary? Because I have already described. Okay, okay. Why medorinum is complementary and sabina is there and silicea is also there. And we can compare with the cannabis sativa, cantheris, copaea officinalis and staphylos grigia. And Cinnaberis is having what's on the glans prepuce. Okay, agar prepuce pe hoga, then we can think about Cinnaberis. But if there is a glans of penis, if there is a warts, then we can think about entimtart is the medicine. Okay, entimtart, glans of penis. Okay, अगर confusion होगा तो just try to remember prepuce, prepuce, prepuce में word में क्या आ रहा है, c e आ रहा है लास्ट में, prepuce, prepuce, c से prepuce हो गया and c से Cinnaberis, prepuce. Okay, so don't get confused. Okay, c for Cinnaberis and c for क्या हो गया, ये prepuce हो गया. ठीक है, and glance of penis पे होगा तो entimtart होगा. Okay, so don't get confused. Okay. And now I'll talk about the aggravation. Suppose if the patient is coming to you and that patient is having aggravation, especially at night from heat of a bed and aggravation at 3 a.m. and 3 p.m., then we can think about Thuja. And after 3 p.m., there are medicine like Apis mellifica is there, belladonna is there. But if there is aggravation, especially 2 to 4 a.m., which medicine? 2 to 4 a.m. The medicine is Calicarb. Okay, but if there is a 3 a.m. is there, then which medicine? Ammonium carb is there. Okay, okay, but if there will be aggravation after the narcotics, then we can think about this medicine. Okay, and another medicine we can think about chamomilla. But if you're talking about the narcotics which is mentioned in the aggravation of a Thuja, so this point we can correlate with the organon of medicine where Dr. Hahnemann has told about the narcotics. Okay, can anyone tell? नारकोटिक्स के बारे में हैनमैन ने कहा बोला है?
113.
113.
113, very good. But in this, we have to record the secondary symptom of the narcotics. Okay, why? Because primary symptoms sometimes takes away sensibility, sensation and irritability. That's why we have to record the secondary symptoms. Okay, sometimes आता है why we are recording the secondary symptoms. So we have to remember because sometimes take away the symptoms, sensibility, sensation and irritability. You will find in the organon of medicine under aphorism number 113. Okay. Okay, thank you everyone. If there is any doubt, you can ask and you can message me, you can text me.